Welcome, everybody, and thanks for joining us. I'm very happy to introduce today Dr. Tali. Tali is a clinical psychologist and an autism specialist, both a clinician and a researcher, and a long-term friend and colleague. Hi, Tali. Thanks for joining us.
Hi, thank you for inviting me.
I thought maybe we should start by you telling us a bit about how you got into the field, into working with kids with autism.
Sure. I was a first year MA student, looking for a job, and then found work as found a job as a teacher's aide with a young child, 3 years old, with autism. And this year was a fascinating year. I learned so much about autism, children with autism, families of children with autism, and working in systems. And then I moved back to my MA PhD studies at the US and decided to focus on this area in order to specialize in autism.
So you actually worked clinically in the US, and where was that?
At Palo Alto University.
Mm-hmm.
And so I started working in Stanford Children's Hospital, assessing young children with ASD, and then at Oakland Children's Hospital, both in California, in early intervention programs with toddlers and their parents. We actually worked in it was center and home-based programs, which was fascinating.
And then you got back to Israel and brought all this vast knowledge and experience with you for
Continued here, yeah.
the benefit of us here. And it seems like it's been a long time ago, but the idea of emotional understanding, of an emotional dialogue with kids with autism has been something that at least we've been discussing for for many years. What was your take on it along those years in terms of practice, of research?
It's a big question.
Yeah.
I think that my curiosity about this field started again during my clinical years as a student, as a graduate student, when I started meeting parents, actually, not just children, but those young kids. I worked a few years with very young kids, with toddlers, but starting to meet parents that went through this assessment process and then received treatment and parent training, and realized that focusing on emotions, understanding emotional experiences, expressing emotions, regulating emotions is a very big issue among these population. Among parents, it's a big challenge for parents as well as for their kids.
Often for kids with autism, discussing emotions, examining emotions, is something that they don't find particularly interesting. Whereas if you'd like to talk to them about trains or dinosaurs, they might be fascinated. But emotions is something that is unclear and maybe sometimes maybe even threatening. How did you get these kids involved in emotional work, maybe through parents or through other ways?
So I think that research shows us that those kids are experiencing a deficit in this area, and this whole emotional understanding, expressiveness and regulation is a big challenge for them. So sometimes I think that we hypothesize that they don't understand those emotional cues, others' emotional cues. Maybe some of them don't process them well. And then maybe some of them process some of the information or the whole information about the other's emotional experience, but they experience difficulties in regulating those emotions or emotional reactions to others. So the behavioral expression is somehow different compared to typically developing on kids.
So if you want to tackle emotional or socio-emotional behavior of children with autism, you'd need to address their understanding of emotion, their expression of emotion, and the regulation of emotion.
Yes, and this is a very concrete construct that was studied for the past 30 years in typical development of young children. And then you and I started being interested in exploring this construct in autism. And so we wrote about it. And I think that as clinicians, we're also very interested in helping those kids to develop emotional competence skills, not just to encourage them to be interested in emotional experiences.
But you know, I want to go back to the question of motivation because that's often a challenge. We know that when working with somebody on a skill, especially something that they find difficult, they need to have the proper motivation to work through this. And this is often a challenge with kids with autism, especially with very young ones. And I was actually thinking about some of your work with projects like the Early Start Denver program, and how do you get parents to be motivators, emotional motivators for their children?
Yeah, I think that the developmental research in autism frequently focuses on identifying inner motivation for those kids to learn. And since they aren't, or some of them are not very interested in their surrounding or in interaction,
Their social surrounding,
in their social surrounding or in other people in their surrounding, or they just don't understand very well what's going on in those interactions. We have to find those those doors to enter, and their special interests that those children show are a really good port of entry for us as clinicians and for parents to teach kids different, developmental skills, including social emotional competence.
so you've been using the children's special interests, whichever interest the child had, to try and engage them in social emotional work through that.
Definitely. And this is, what the ESDM taught me, how to use special interests and how to encourage parents to use those special interests. So I think that, as a contrary to more structured and very conventional applied behavioral analysis interventions that define special interest as something that is very, interfering with children's learning. I think that NDBI's natural behavioral developmental intervention models consider them as motivators. So we want to use kids' interest in dinosaurs, in letters, in colors, in unicorns, to teach them different skills, including to teach them more about, their emotional world.
In a way, in order to do that, because the child is often interested in other areas, but does not necessarily associate them with social or emotional material, the person who would have to do that would either be a therapist or a parent. And I'm just thinking about the recent work that you've been presenting about how parent-child positive affect, shared positive affect is improved following this kind of work. I wondered what kind of advice you give parents, what kind of coaching you give them in order to get this effect?
It's a good question. First of all, I was taught that the first necessary element in working with parents is psychoeducation, is providing them the rationale for it, because not everything makes sense for parents, and many parents do not want to use their child's special interests and even more focus on it than than usual.
Yeah, sometimes they're also advised by therapists to do that, right?
Try to do that. Yeah, try to reduce or even ignore. But again, research teaches us that we have the social theories, developmental theories that show us that children learn that interaction is fun when they actually enjoy it, when it's interesting, when it's motivating, when they experience positive emotions during this interaction. And that's the rationale for being happy, for being for expressing positive affect as a parent with the child. I encourage parents to just to see or to identify what their child is enjoying from, and do it together with him. This is what we do in the ESDM. And once the parent identifies this activity that the child enjoys from, they can turn it into an activity that they do together, and then the child not only enjoys from the object, so the enjoyment becomes a shared enjoyment. So they share positive affect. They share, different positive emotions, like they both can be excited and happy and enthusiastic about something, but share it together.
And I think that another area that kids are often advised to stay away from, especially kids with autism, because they are believed to get lost in it, are screens, right? So preferably you should stay away from television or from computers or from tablets as much as you can, because that's not good for you. But you are using television as a way to motivate, teach children about emotions, right? How does that happen?
So first of all, I think that none of us can ignore the fact that screens are a very central piece of everyday's life for us as adults, and also for typically developing children. Um, and kids on the spectrum, again, they can learn so much from a structured environment. So we actually found in our study that they can watch an animated series that you developed in Cambridge and brought to Israel, and then learn about emotions, about emotional and social experiences during interaction. They can learn to understand different emotions, simple and complex, and mental states. And then it impacts their ability to express and to regulate emotions as well, and also to interact with peers.
So what did you find about that?
So first of all, we found that this way of learning for young kids on the spectrum is effective in developing their ability to better understand different emotions and recognize them. And another interesting thing that we found was that it also impacts their ability to be more empathic toward peers during a shared play, during an interaction with a peer, which is totally different from this, very structured, animated series in which they
that's very critical. I think it's often argued that if we teach something in a structured way, then kids with autism find it challenging to generalize these skills to social interaction in real life. So you actually had some social interaction with a peer and showed that whatever the children learn using this animated series can then be generalized into. Mm-hmm.
Mm-hmm. I think this is what we always look for in intervention. We want to know whether this intervention can be, or those skills taught during the intervention can be generalized in their natural environment, which is at home or with peers. And we actually found out that they do generalize this understanding, and that it impacts their ability to be more empathic, more positive for their peers during an interaction, which is something that is challenging for kids on the spectrum.
And what do you think facilitated this generalization? Is it enough? Is it sufficient just to watch a screen in order for these kids to generalize?
No, I think that both of us know as clinicians, not just researchers, but also, again, there is a lot of research about parents as facilitators and as agents of change, especially with young kids on the spectrum, but not just with young kids. And we know that when parents are involved, even when a child watches an animated series or plays in his Xbox computer game or does something by himself, if a parent is involved and can either refer to it or um, um, talk or discuss those topics with the child
Emotionally elaborated.
During their time at home, it facilitates generalization.
I mean, I remember that it was fascinating to see how even for our control condition in that study, that was just an animated series of children, TV series that was not focusing on emotions, not teaching emotions. You actually created a manual for parents, helping them use this series to teach their children about emotions. So, in theory, this could be done with anything.
Yes, definitely. And I think that this is what we try to do in our clinical work in general. Encourage parents to take those skills taught in the therapy room and implement them during their daily lives with the kids. Because this is where we want them to use those skills.
Yeah. So using getting the help of parents as our partners in facilitating emotional understanding, emotional competence in their children with autism. And I think that recently you've been also doing this in another area of emotional competence around emotion regulation in your groups, right?
Right.
Do you want to tell us a bit about that?
Well, that's really interesting because the protocol we work with.
That's the Pact, Angela Scarpa and Tony Atwood.
Camp, yeah. That was developed by Angela Scarpa and Tony Atwood.
I'm sorry. Yeah, this town.
It teaches children different emotion regulation tools and skills. And again, parents are very central in this process of change because parents learn, the same tools and techniques as the children. And then the parents and the children practice those techniques and tools at home and in social interaction with peers. And when they go to grandma and grandpa, and in school. And it's interesting because, now during the COVID, we're actually thinking about the possibility of moving to telehealth and try to conduct those groups via Zoom.
Online.
To do it online. And I think that, again, the rationale was that we don't necessarily need the therapy room to teach kids and parents different skills. And maybe if we conduct this teaching process in their natural environment at home, it will be useful as well.
Maybe even more effective. So at least it would be easier to generalize.
Yes.
Yeah, that looks very promising.
Just had another idea about, how this period provides us the opportunity to use the screen in order to get a peek in families' daily lives at home. thing that we don't usually do when we meet them in the clinic or in the treatment centers, right? We meet them, we get reports, we get to hear about the children's functioning and challenges at home by the parents. Sometimes the children report as well, teachers report, but we don't actually see what they mean. And the screen provides us the opportunity to observe on their daily lives, on different challenging situations they experience at home, even observe on their home environment, something that we sometimes, focus on.
It can also sometimes feel, I guess, for some families a bit intrusive, right?
Right. So of course we have to, to check whether they feel comfortable with observing, the home environment or observing them during a daily routine. But actually sometimes they want us to.
So your impression is that they actually welcome this kind of intervention online.
Most of them, yeah, most of
and
them
would be interesting to see what happens when COVID is gone. If this kind of intervention is going to continue, be provided through telehealth, or at least also through telehealth.
Well, our partners, clinicians and researchers at the US, in Australia, in other countries that are challenged by, the inability to provide services from families living in all those rural areas, have been doing it for a while. And there is also research about, telehealth in autism, with young children and not just young children. I think that it's a great tool to use with families, even in Israel, which is such a small country. We can't always help families from different, cities or areas in Israel. And using technology, we find it so much easier to provide services, assessment services and treatment services.
No, it's an interesting thing is that you get to see that even in these areas of socio-emotional functioning, that you could argue that they require face-to-face interaction. Still, we can offer services, clinical services that are not only welcomed but might also be found to be effective. And so,
I think that as long as we work with caretakers and not just with the kids.
Yeah, so with somebody who could take responsibility for the child's ongoing learning of these concepts when we turn the computer off. Definitely. Or the telephone. Thank you. That was very impressive to see how all these different aspects of social-emotional communication or social-emotional competence in children with autism are approached and taken care of through different kinds of services and research, of course. And thank you so much for joining us. It was a pleasure, and I look forward to our next talk.
Thank you, Ofer.